You may have heard the statistic that nearly 9 out of 10 adults in the US have struggled to either understand or use health information at some point. You may have also heard that limited health literacy costs the US healthcare system up to 238 billion with a B dollars in preventable health expenses each year. But usually we still think about low health literacy as a person problem instead of the systemic problem that it really is. That's where organizational health literacy comes in.
Hey, Megan,
Yeah.
what's that?
Organizational health literacy is when organizations assume responsibility for helping people improve their health literacy. Organizational health literacy is all about enabling people to better find, understand, and use health information and health services to inform their health related decisions and their health related actions. You get it now?
Yeah, but I have another question.
Okay, what's that?
Who are you?
2 steps ahead of me, friend. I'm Megan Freeland. I'm a public health pharmacist by training, but my work is best represented by a blend of public health, health equity, and health literacy. As I always say, my professional mission is to fight health misinformation by strengthening organizational health literacy. And now we all know what that is. My genuine hope is that the conversations we'll have here will feel like a breath of fresh air. I know many times leaders across healthcare, public health, life sciences, who work in health literacy specifically or whose work is adjacent to health literacy might feel like these initiatives are not always fully appreciated or valued. But the work that you're doing is really helping to address a systemic problem. And it's essential that we not only highlight that work, recognize that work, but that we also share our lessons learned, things that went well, things that we might do differently in the future with our peers so that we can collectively continue to improve patient outcomes, but also so that we can encourage other organizations to take on big organizational health literacy challenges themselves. And so we're going to be celebrating wins.
Even the small wins?
A win is a win, friend. So, yes, even the small wins.
Cool.
Cool. Now, we can't talk about the wins without talking about the challenges. So, we'll also be surfacing those challenges here so that we can share with and learn from each other.
Oh, how sweet.
Yeah, but it's not just sweet. It's actually essential for improving patient outcomes and for encouraging other organizations to take on big health literacy challenges themselves. So, if you are looking forward to the podcast, let me know in the comments. I am so excited to release the first several episodes, which are going to serve as a primer for organizational health literacy, and then moving into some really incredible interviews with leaders across healthcare, patient care, health equity, etc. And if you know of anyone who might be a great guest on the podcast, who would be willing to share some of their wins and some of their challenges, please feel free to head to the comments and check out the podcast guest recommendation link. I'm so excited to continue these conversations with you all, and I'll see you next time.